It's great to be here with you, Vinnie. Thank you for hosting me. I am looking forward to sharing our story at Vida and how we are leading in the digital health space in terms of really solving mental and health, mental and physical health problems for individuals living with chronic disease, both physical and mental health disease. You know, I started the company because I experienced this myself. My father, much like many of Americans, had multiple chronic conditions. He was living with diabetes, obesity, CHF, COPD, and depression. And I was really trying to find an integrated model, and there really wasn't anything. And given my background in technology, I've been at eBay and Google and built products that have scaled to millions of users in the commerce sector. I was looking for a mobile solution that had day-to-day accountability with a human, with remote patient monitoring and the ability to really understand what he was talking about across his conditions. And so started prototyping, and that's how Vida came to be. And recently I was looking at one of our we have all these customer stories. They're just wonderful. And I was looking at one of them, and here he is, and he had lowered his A1C by 6 points in 6 months, actually. And the quote that he shared was, "Vida saved my life." And I read that story and thought of, this is like, we're helping so many people. And this is like my father's situation. So that's what we do. We really combine mental and physical conditions. We came at this from a very human-centered approach that everyone needs a holistic approach to their health, and mental and physical conditions really never stand alone. They're completely interrelated. I read a quote over the weekend by Dr. Mark Hyman. It was one of his Twitter feeds, and he said, every cell in your body is listening to your mind. It's very true.
Now, Stephanie, is this primarily an extension of telemedicine?
It's telemedicine. We are a telemedicine service. We are a licensed medical provider in 50 states, and we have therapists, nutritionists, registered dietitians, coaches, et cetera, throughout all. We have a network across 50 states. So we're tackling chronic disease, and as you can see here, 90% actually of the 4 trillion plus that we spend on healthcare is focused on chronic disease. We really have a very reactive mode today to chronic disease. You tend to go to the doctor after you have it, after you have symptoms, you get a prescription. We don't take a very continuous care. We sort of take this reactive, you have a visit, you get a med. We don't look at it day to day and how it's integrated into your life and how to really keep it in check. And unfortunately, chronic disease is something like that. It can be put into remission or reversal stage, but you can't really get rid of it entirely. It needs to be something that you need to be vigilant about for your whole life. And so the continuous care model makes much more sense in chronic disease. And that's what we're doing at Vida. And so there's 147 million people in the US living with chronic disease, and we're really focused on those individuals. And if you look at the individual conditions that people live with, it's a huge market. It's $1 trillion addressable healthcare market. You've got diabetes, hyperlipidemia, high cholesterol, hypertension, anxiety, depression, asthma, COPD. These are all very high cost conditions in our society today. We have seen a flurry of point solutions over the last 5 years evolve so that companies are built focusing on just one solution. And we think that doesn't really address the reality of the individual human. They don't want to go to 5 different apps, one app for heart health, one app for their nutrition, one app for their sleep, one app for their weight loss or their anxiety. So we really want to have an integrated approach, and that's what we've done at Vida. And what we're doing is really solving many different pain points in the market. I thought I'd just spend a minute talking through the different stakeholders and why solving healthcare in this way is so important in our country. So if you look at employers, 156 million people have their healthcare through their employer. And in particularly in the last year, COVID has been a massive accelerant for individual employers to realize they have to do something for individuals living with diabetes and other chronic diseases, physical chronic diseases, as well as mental health. With COVID, there's been we've moved from 1 in 5 people having a mental health condition to 1 in 2. And now employers are recognizing they really need to do something for people's mental health. So that's the employer segment. And then if you look at large national insurance companies, which we call payers, they tend to look at how can they look across their population at the highest risk and really intervene to reduce costs. And individuals that are living with diabetes and depression are 4 to 6 times more expensive. So that's one of the things that one of our sweet spots is really helping people that have both of those conditions. And now with COVID, there's been an accelerant in everything moving virtual. So now reimbursement for therapy is all equivalent virtually versus in person, and most everything has moved virtually, and people prefer it. Actually, you're seeing amazing reception to it. And then, members themselves, consumers just want instant access. And in our healthcare system today, and at least prior to COVID, it took 24 days to get an appointment with a PCP. It took sometimes longer than that to get an appointment with a therapist. You're seeing this need for instant access, and we provide, again, we're a registered medical provider. We provide instant access in 50 states. So those are some of the kind of key pain points that we're solving in the industry. And the pandemic has created a mental health revolution. You're seeing just incredible awareness now and understanding that this problem has to be solved, and the mind and the body are inextricably linked. So this is a study that Connor led, and we did this across thousands of people earlier, late 2020 and early 2021. We just released this. So 1 in 6 people have started therapy since the pandemic, and 88% of people, 88% have experienced at least one condition of depression. It's pretty remarkable. So you're seeing a real shift in recognition that you have to treat, again, the mind and the body.
Well, Stephanie, I hope we also feed this. I don't think we need to. I hope every governor and every mayor and all that is factoring this. We haven't, in the lockdowns, we haven't seen much accounting for the cost of isolation and mental health, right? So hopefully this will elevate the calculations we need to do about that.
I think we haven't calculated. I think we've seen it. We've seen the impact on children, on parents handling their children. We've seen it on people dropping out of the workforce. Right. So there's been, I think if we actually took the time to calculate it, it'd be quite high. So one of the things that we do is really take this holistic approach, combining mental and physical. So this is an example of somebody this is a true story, Judy. She works for one of our Fortune 500 customers, and she has mild anxiety, moderate depression, obesity, and diabetes. Very, very common profile that you would see in the United States. She comes in to Vida, and we're really treating her across the board. So she has a diabetes educator for her depression. For her diabetes, she's enrolled in a diabetes management program, and she has a therapist for her depression. And you can see that over the course of just like 3 months, it's incredible, actually. She's got a 92% reduction in the PHQ score, which is a score for depression, and an A1C reduction, which is a measurement of for diabetes, a 1.1 reduction in 3 months, which is really high. So just to give you a little bit more color, if you really, if you look at A1C, if you can get a point reduction, that has massive implications for getting you to the place where the disease is being reversed. If you're above an 8 and you get a point reduction, you get closer to a 6. If you get below 6, you're sort of in a place where the diabetes is not really affecting you. And so we aim to get everyone below 6. And so this point is pretty meaningful. So we see very strong outcomes in short order, and then people stay in the platform for a year and they maintain the outcomes. And then what we see with, when we combine this approach to handling both diabetes and depression together, what's really fascinating is because we're all human and it's all connected, we see a 33% greater improvement in the core metrics for each one. So for example, you'd see a 33% increase in A1C reduction when you're doing diabetes and therapy together. So these have they're meaningful impact. And we published recently this summer, we published a peer-reviewed journal showing our outcomes in anxiety and depression. And what we did is we measured the PHQ and the GAD. These are clinical scores for anxiety and depression over a period of 9 months. And you can see the impact here. So typically the way we work with customers is we will contract with a large Fortune 500 company or a large insurance company, and we will market to their employees or their members, and we offer a choice. They can look at whether they might have diabetes, but they want to start with weight loss and sleep, and we eventually get them to manage their diabetes. So we really offer choice. And we have motivational interviewing with our coaches, so we really understand what their root drivers are and get them to the right place. We use all different types of marketing to get people to enroll, and then once they enroll, they're enrolled in a specific program or programs, and they immediately pick their provider. We call this Match.com.
What are you finding? Do the employers pay for this, or?
The employers pay for this. It's free for service. It's free for the employee and it's free for the member. Yeah. And so when they come in, they're able to look at a range of different providers in our network. Therapists or nurses or coaches or dietitians, and they pick. They look at usually 5 different choices, and they get to pick who they work with. And that's really important because we want them to have a therapeutic alliance with this individual. And it's like a continuous relationship. Think of it as like kind of like a PCP relationship, a primary care relationship, but it's not a doctor. It's the way we see the healthcare system evolving is doctors will practice at the top of their license, and then nurses, therapists, coaches will practice at the top of their license. And then there's obviously a lot of technology, digital therapeutics and bots and everything that will do the rest and automate as much as possible. And so this is an opportunity to really, leverage providers outside of just physicians to really provide care for chronic disease. And we provide a lot of personalized content, exercises and tools in the app. We track your progress over time. So we generally, if you have diabetes, for example, we'll ship you a cellular connected glucometer and a scale. And so we're looking at your progress and your statistics over time. And it's really important that we are able to cover the whole population. So when we look at rolling out to an employer, we cover those individuals that might be overweight or pre-diabetic all the way to those that are on insulin and oral meds. And we really manage across the risk of that population. We provide different levels of service depending on their needs. And again, I mentioned we have this 50-state network with over 1,000 providers, and we cover a range of different areas. We do constant training to make sure we elevate the quality of our network. We're always measuring and auditing how we're progressing. We measure NPS, we measure performance. So we really are trying to create a really high quality network and intervention. And we have a really high engagement. So we have 15 weekly app opens, and 77% of people are engaging weekly and talking to their coach. So very heavy engagement, and that leads to outcomes. We see very strong outcomes, best in class in diabetes, in hypertension, depression, anxiety. These are all areas that are clinically measured. We use the same clinical measures as the standard medical providers would in the industry. And we're showing that online virtual care can get better outcomes than offline. And it's that continuous relationship and that monitoring, that remote patient monitoring and getting all the information and watching your progress over time that really makes the difference. And then I would say that we one surprising thing is that the need for Spanish, or I think we built Spanish this year because we're in Texas and Florida, And we've had so much demand for this product. We launched all of our products, all of our programs. We hired providers as well and did all of our marketing in Spanish. And our NPS for our whole product is 76, but our NPS for Spanish is 87. So the Spanish speaking users love the service. And I'll just close by saying that we have 1.9 million lives in our covered in our network, and we're serving large employers like Boeing or Cisco and Visa, and large payers like Centene or Humana. So that is the story on Vida, and I'm happy to answer any questions you may have.
Yeah, so is more of your effort going into building the network, certifying it, or is it more in building the, I mean, clearly revenue is important, but where is more of the effort?
Well, it's all of the above. We spend quite a bit of time building out the platform and the product and technology. And it's really important to keep adding new clinical areas. Like, for example, last year we added CHF, congestive heart failure, for our customers. So we're always innovating in adding new programs, expanding the machine learning and the infrastructure in our platform and our service, improving our product. We are constantly adding to our clinical network and our efficacy and our training and up-leveling our network and adding and expanding and growing. And then we're always focused on expanding sales and marketing as well. So we really are investing across the board.
Great. And you said 1.9 million already?
Covered lives, yeah.
That's a decent. How old is the company?
We had our first commercial customer launch in 2015.
Okay. No, this is neat. I didn't realize you had so many different diseases covered. So
yeah, that was the intention, is to really build a platform for chronic disease and the ability to add new diseases as they come up. Anything that really should be handled digitally and as a complement to the physician and in an ongoing continuous care way to really help reduce healthcare costs and improve outcomes.
Where do you see what's the next couple of areas you think you can move into?
We're expanding more in other more severe mental health areas this year. We're looking at other physical conditions like chronic pain and other areas. So we're
looking about arthritis and so on.
Yeah. So we're looking at all of those.
Great. Well, thank you, Stephanie.
You're welcome. Great to be here, and it was great to talk to you.